talking about a common cause of low back gluteal region pain, specifically sacroiliac joint pain or sacroiliac joint dysfunction. So when we think about sacroiliac joint dysfunction, again, we will systematically go through the common presentation of that, but as a real quick review, so sacroiliac joint dysfunction, which obviously we are talking about pain, inflammation at the level of the sacroiliac joint, the joint between the sacrum and the pelvis, the ilium. This is many providers would consider this an under-reported cause of low back gluteal region pain. If you look at the research, studies will quote anywhere from 15 to 30% of low back gluteal region pain presenting to the clinic is due to sacroiliac joint dysfunction. Some of the things that, and we'll obviously talk about this when we're talking about the timing of this pathology, but some of the risk factors that may get you to start to think about sacroiliac joint dysfunction would be individuals who've had a prior lumbar surgery, especially obviously a fusion down to the sacrum, because then that's going to put some additional stress on the sacroiliac joint. So you will hear us refer to that throughout our talks in terms of adjacent level syndrome. So prior lumbar fusion, history of trauma is another risk factor that you want to start to think about sacroiliac joint dysfunction, especially if they've had a fall onto their buttock or potentially a high force incident such as a car accident. Pregnancy is another potential risk factor for sacroiliac joint dysfunction. Any leg length discrepancy that individuals are dealing with for a long period of time, those altered biomechanics can put you at risk for sacroiliac joint dysfunction. Then of course inflammatory arthropathies can involve the sacroiliac joint as well. So now moving to that common clinical presentation of sacroiliac joint dysfunction. So in terms of starting with location, because as always we'll go through location, the quality, the radiation, the severity, the timing, what makes it better, what makes it worse, with accentuating, alleviating factors, and associated symptoms that can present. So in terms of the location for sacroiliac joint dysfunction, typically that pain is going to be lateralized out to one side or the other, and it's going to be a little bit lower than we would typically see with our usual lumbar pathology, specifically in terms of lumbar facet type of pain, although obviously there's a significant overlap there. The sacroiliac joint dysfunction usually is going to be a little bit lower. Now, this kind of comes into the physical exam, which obviously we'll talk about moving forward, but that specific location of pain, one of the most sensitive and specific physical exam maneuvers is actually Fortin's finger, meaning that when the patient points to their area of pain, they're pointing to the posterior superior iliac spine, or the PSIS. So as stated, that specific location is usually one of the focal or center points of the pain is usually at that posterior superior iliac spine of the patient. In terms of the quality of the pain, so like most types of joint pain, there's going to be a lot of aching component to the pain. Deep ache, oftentimes I hear my patients describe it as, it can be sharp with exacerbation. Certain maneuvers that tend to flare it up can cause that sharp grabbing pain. In terms of the radiation of the symptoms, so just like nerves have referral patterns, and as we know, muscles can have referral patterns. Same thing with joints, they can have specific referral patterns. So the sacroiliac joint, although it does cause pain in that typical posterior superior iliac spine region, it can refer pain down into the leg. So it can kind of mimic the path that a radiculopathy may take to some degree. So individuals can get gluteal pain, thigh pain, and even into the leg to some degree. Usually not a lot of foot pain, but just being aware that SI joint pathology can have that referral pattern into the leg as well. In terms of the timing of onset of sacroiliac joint dysfunction, just like we talked about, I would say a little bit more so than lumbar discogenic pain or lumbar facetogenic pain. With SI joint pathology, there's more often a predisposing traumatic event leading to the development of their symptoms. And then, like about a lot of other joint pathology, it's not uncommon, especially obviously if we're dealing with an inflammatory arthropathy as one of the causes of the SI joint dysfunction. It's not uncommon for that pain to be fairly significant first thing in the morning, and then as the patient is able to move around, the joint pain may get a little bit better. In terms of what's making the pain better and worse, so in terms of accentuating factors for SI joint dysfunction, so a lot of individuals will state that prolonged sitting can be problematic for them. In fact, when you walk in the room and the individual is kind of avoiding sitting on one side or the other, obviously that's going to start to make you think about SI joint dysfunction and or an acute radiculopathy, avoiding weight on that side. So prolonged sitting is definitely an accentuating factor for SI joint dysfunction. Prolonged walking or prolonged standing as well. That change in position, going from sit to stand, can sometimes be relieving for the patient for a short period of time, but then any prolonged position, whether that's sitting, standing, or walking, can start to be problematic for the patient. In terms of associated symptoms with SI joint dysfunction, that in this specific instance, those associated symptoms, we're making sure to rule out other processes and symptoms that may get us to start to think about other pathologies causing the patient's presentation. So if we do see a lot of associated weakness, numbness, then of course, although there can be some pain-limited weakness with SI joint dysfunction, if we're hearing weakness, numbness from the patient, then we're going to potentially start thinking about a different pathology, or maybe a concomitant process in the lumbar spine, such as the lumbar radiculopathy, that's causing that weakness, numbness, because unless it's pain-limited weakness, of course, we're not necessarily going to see that as much with the SI joint dysfunction. And then always making sure to rule out our red flag signs and symptoms, including fevers they can't explain, weight loss that the patient can't explain, history of cancer. I know I've said that over and over again, but that being an important item in the history to make sure we're always identifying, because that's going to increase the chance that this is something more concerning going on for the patient. That was the quick presentation in terms of sacroiliac joint dysfunction, and we'll see you guys soon for the physical exam.